Studies actually show that long-term runners have healthier, larger intervertebral discs than non-runners. So if your back hurts, it is not the running. It is a mechanical failure in your kinetic chain. The problem usually isn't what you do during your run. It's what you do the other 23 hours of the day. Sitting shortens your hip flexors, specifically the psoas major, which attaches directly to your lumbar spine. When you stand up to run with tight hip flexors, your pelvis is pulled into an anterior tilt. This forces your lower back to overarch just to keep you upright, jamming your facet joints with every single step. Most runners try to fix this with sit-ups, which is exactly the wrong move. Running is a series of single-leg balances that requires anti-rotation stability, not flexion strength. You need to stiffen the torso, not curl it. We rely on the McGill Big 3 protocol for this stability. These 3 specific exercises create a stiffness corset around your spine without placing compressive load on your discs. Before you strengthen, you must mobilize. You have to lengthen the hip flexors to allow the glutes to fire. If your hips are locked, your lower back takes 100% of the extension force. Biomechanically, your cadence plays a massive role. Overstriding, landing with your foot far ahead of your center of mass, act as a brake, sending increased impact forces straight up the chain into the lumbar spine. However, you must know when to stop. Mechanical back pain is usually dull and localized. If you experience shooting electrical pain down the leg, numbness, or weakness, that is nerve root compression. For general aches, bed rest is the enemy. Movement lubricates the spine. Start with walking, progress to the Big 3, and return to running only when you can maintain a neutral pelvis without pain. Stabilize your spine, mobilize your hips, and stop blaming the run.